morning. If it's noontime and it's Monday, and if you guys look like Rotarians, this must be Rotary. So welcome to all of you this morning. I guess it's afternoon now. As we start our program today, I think it's going to be an excellent program, but let's start with a reflection. If you'd stand, and then we'll stand for the Pledge of Allegiance. First, Father Ron, and then Wes Gun.
God, our Father, you have abundantly blessed every one of us in this room today. Rightly, we give you thanks for our physical, material, emotional, and spiritual well-being. This afternoon, our thoughts and so our prayers turn towards all those suffering from mental issues. Their struggles are oftentimes more serious and more difficult than physical or material hardship. We lift to you in our prayers today all those so suffering. And we also lift to you in our prayers the wonderful people like those at Harbor who commit themselves to help those in need of such assistance. Truly, they are angels, messengers sent from you to help your suffering sons and daughters. Bless all those whose work is to be good Samaritans for those who suffer. To this prayer we say, Amen.
I pledge allegiance to the flag
of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We have a meeting sponsor today. It's WGTE, and we would like to thank them for sponsoring the meeting this month. Visiting Rotarians, who's introducing them? Wes?
All right, President Tim, we have two visiting Rotarians today. Visiting Rotarians, please stand as I read your names and remain standing until President Tim welcomes you. We have David Dennis, who is the District Assistant Governor for Area 3, which is our area. And we have Allison Glover, who is the District Rotaract Co-Chair and also happens to be my wife.
Dave and Allison, thank you very much for joining us today. I hope you enjoy the meeting. Could I invite members to introduce any guests today?
President Tim, fellow Rotarians, my guest today is my nephew, Val Kaba. Val is with the State Bank. He's the Assistant Vice President. He also covers the Toledo and Bowling Green area.
Val, welcome.
President Tim and fellow Rotarians, I have two guests. One I think is familiar to almost everyone here, Doug Adams-Arman and Jake Vukrenik. They are bringing all things blockchain to Toledo, so don't ask me about it, but ask them.
Welcome to you both.
President Tim, my guest today is Jackie Harrington. She's the signing director at CLA and our nonprofits team.
Welcome, Jackie. I hope you enjoy the meeting. I saw a stranger out there. I don't know if he disappeared. Daniel Ebert, I see you brought your wife, but welcome, Daniel. We're glad to have you back. And Andrea, welcome. This is a good time to go on to social media and do some free advertising for us and tell everybody what a great time you're having and what a good president you've got. And after you're done with that, would you please turn off your cell phones? Okay. It's my very sad duty to say to you that a former member of this club, Robert Edward Alexander, passed away last Monday. I never met Mr. Alexander. He left the club in 2012, just when I was joining the club. But I wish I had. He was a very active Rotary member with this club. He spent most of his working life with YMCA, and when he retired, he was the CEO of YMCA and JCC of Greater Toledo. Robert was a Rotarian. He was a Paul Harris Fellow. He was very active. He served as a director of this club for many years. He was also a volunteer for the Toledo Northwest Ohio Food Bank, the Victory Center, and amongst other things, the Ability Center. He lived a life that exemplifies the notion of service before self, and he will be missed. While I personally never met the man, there are people in this room that did know him. Many of you saw that we have a photographer outside. Her name is Sheena Kay. She's a professional photographer, and her role here today and next week is to be taking headshots for the new Rotary Directory, and she's working from 11 to noon today and 1 until 2 o'clock later in the afternoon, and she'll be here next week, and she's going to work from 11 to noon and again 1 to 2 next week. And just so you know, she has personally told me that she can take 12 pounds off everybody. We were originally going to have Vice Chairman Ford Bennett with the International Committee come up and speak, but he's said to me that he's feeling shy today, which is surprising for a Marine. But having said that, we do have Rotarian Dennis Sawa, and he's going to talk about I think it's the Mesa stuff. It isn't in my notes here, but regardless, a few interesting things about Dennis. He's a lawyer. I know what he's doing. He has a passion for video, and he's going to take one. He's also a skydiver, and he wants to ride bulls if he survives skydiving. So if you please welcome Dennis. Where are you? Not bad for the last minute.
Thank you, President Tim. And fellow Rotarians, my name is Dennis Swan, and I had the pleasure to serve this year on the committee for the Mesa Toledo Bike Ride. The event took place on Saturday, June 8th, and it helped to raise funds for sending medical equipment abroad. As we're still finalizing totals, we anticipate that the donations will exceed $6,000. First and foremost, a huge thank you to our sponsors, the Makalinsky Foundation, Metro Parks Toledo, We Are Traffic, Maumee Valley Adventurers, and Fifth Third Bank and Little Caesars. I'd also like to extend a heartfelt thank you to our chair, Ford Bennett, who did a phenomenal job, as well as committee members Mike Noble, Danny Woodcock, Melissa Tanzi, and Kevin Mullen for all their hard work for this very important cause. And a special thanks goes out to Katie Hahn, who I think is maybe around here somewhere, for all of her hard work in building the website. This was the first year we used digital sign up, and it was very appreciated. Finally, I put together a brief video recap of the event, and so with no further ado, I hope you all enjoy and have a great day.
Bike Ride and Mesa are great things. I think many people have fun riding the bikes, and it's always nice to raise a few dollars for Mesa. They do some great stuff. I've seen some amazing things overseas that Mesa has performed. Next, I would like to invite to the podium Vice Chair Shireen Morard of Member Development. Before I introduce or let Shireen have the mic, just a couple of things. Shireen, if you don't know it, is an excellent chef. She's a great bowler, and she loves Paris. What's not to like?
Thank you. Good afternoon, fellow Rotarians. It gives me great pleasure to stand before you and officially announce this year's member development objectives and goals. Despite the overwhelming feelings that you may be experiencing right now, please hold your applause to the end. First and foremost, I ask you to take a quick look to your right and left. And now I want you to know what you just did. You looked at everyone that's in the Member Development Committee. That's all of you. That's right. Each and every one of you are part of our committee, whether you actually decide to attend our meetings or not. We can't accomplish our goals without you. If we succeed, it's because every person in this room contributed to that success. That said, if you would like to attend and be a part of our committee, please contact myself, Andy Fox, Katie, or Kathy, and we will be sure to make you aware of all the future meetings. Now on to the good stuff. We have one very simple goal this year: to obtain 50 engaged, not just members, but very engaged members and qualified people. The stats don't lie. 80% of the Rotarians who are engaged at the club are likely to remain Rotarians, and that's what we want, is longevity in our group. In order to do this, I want you to take a quick outline of our year's events and new tactics and objectives. So first, we're hosting 4 to 5 Rotary after-hours events. One is right around the corner, Thursday, August 1st. And I know President told you guys to take your phones and put them away, but I'm asking you to take them out. I'm sorry. And I'm asking you to put that in your calendar, because having you attend the event is really important, because we really need to engage all of our members and bring new members and explain to them what Rotary is and what the gift of Rotary would be. So it is at H2O, Thursday, August 1st. And it's between 4:30 and 8. Don't forget to bring a guest. We need everyone to bring a guest. If everyone brings a guest that's in this room, I'm pretty sure we're going to double our place. Okay, so the other 3 events will take place in October, January, and April. More information to come regarding those. We're also planning a golf outing for the end of the summer. And we have something new, of course. We are having, for our lunch guests, you've noticed this glass bowl. It's going to be right outside. On the desk as you arrive, we are capturing guest business cards, and we'll be performing a monthly drawing. Each month, we will pull a business card right out of this bowl and award a lucky recipient and a guest a free lunch voucher. The member who obtained the guest will have their name written on the back, so make sure if you bring somebody, you put a business card, please put your name on the back, or you won't receive a free lunch as well. Okay, so don't forget to do that, and we're also encouraging everyone to bring guests. And if you walk in at noon and you grab your food and you sit down, obviously people cannot talk to other people and get engaged with the community and the gift of Rotary. So please attend a little bit early and start talking to other Rotarians and getting to know them, and so that your guests can get to know them as well. All right, I'm done. Wrapping things up, let me give you a quick Cliff Notes. 50 engaged new members within the year. Rotary after-hours events that we need all of you guys to attend. There's not that many, so please attend them. And check in your guests at the sign-in table, and make sure you put a business card and put your name on the back of them. And recruit, and share the gift of Rotary to ensure our long-lasting growth as a club. Thank you.
Shireen, let me assure you that as long as you're willing to raise your hand to volunteer in this club, you're not done. We have a grant presentation today, and our presenter is well known to this club. He's Tom Backoff. He is a past president. He's a foundation trustee. He's a golfer. He says he's smart. He's worth listening to. I think some people say he's a good golfer, and if you need a forklift, he's the guy to see. And I'm told that he has good hygiene. Tom.
Thank you, President Tim. You're doing a great job. You're 10 minutes in. It's terrific. Good afternoon, Rotarians. 2 weeks ago, President Tim, in his inaugural message to us, mentioned his desire that our club take a more active role to address challenges in our community, particularly as it relates to our transformational projects. Today, it is my honor, on behalf of the Toledo Rotary Club Foundation, to present a grant that is a step in taking a more active role in our club's ongoing efforts to improve the water quality of Lake Erie. The Water Committee, currently chaired by Sherry Budzinski, has worked diligently since 2015 to help educate our region regarding harmful algal blooms, also known as HABs. We hosted 2 conferences dedicated to bringing experts from across the country to discuss what causes the bloom and what we can do about it. Our club, along with District 6600, has been doing ongoing water testing, mostly led by Janina Douglas. Our model has been so effective that now Rotary clubs in Florida and from the Mississippi River watershed are contacting us for advice and counsel. The problems caused by harmful algal blooms in Florida and along the Mississippi River are created the same way as in Lake Erie. Thanks to your dedication to solve this problem and your generous donations, today our club and foundation take another step to become more active in alleviating harmful algal blooms in Lake Erie. With our gift of $5,000 to Great Lakes Observing System, we are helping to fund a documentary that will raise awareness to the harm being done to Lake Erie and allow us to work with other organizations so we can heighten awareness for better policies at both the state and national levels. Accepting our grant today is David Fitch, who's communications specialist with Great Lakes Observing System, who will partner with Great Lakes Media Outreach to produce the documentary. David, please accept our grant. And David Ruck showed up just in the nick of time. David is president and producer of Great Lakes Outreach Media, and David will be in charge of filming the documentary. So which David is going to come forward and tell us more? Okay, great. So David Fitch is going to come forward and tell us about this important project. David?
Hello, everyone. Thank you so much for having me here today. And thank you so much for your generous support of this effort. Like Tom said, I work with Great Lakes Observing System, which is run through a NOAA program, and we exist to make Great Lakes data work for people. So after 2014, that started to look a lot like building tools to help Lake Erie water managers understand what's coming into their pipes so that they can better provide for their communities. I'm extremely excited about the other David's project, which your dollars are helping to support, which highlights the work that we do as well as the work that others do. Tom asked me to say a little bit about the latest that we've heard about the bloom this year. Last week there was the annual NOAA HABs forecast event. They're estimating that this bloom will be a severe one, not as severe as last year's, but one that does cause a good amount of concern. So we thank you for your ongoing support and for the work that we do. And I'm going to introduce the other David, who is going to be actually putting boots on the ground and producing this video that will give awareness to what we're doing in the area. Thank you.
Literally just in the nick of time. I see Tom up here on the stage as I walk in. I came from Muskegon today. My name is David Ruck. I'm the president and producer of Great Lakes Outreach Media. Thank you, Tom. Thank you, David. Thank you, Rotarians, for honoring us with this donation. In case some of you were under a rock this weekend, the bloom has started as of this weekend. Last Thursday, we were on the Stone Lab, part of Ohio State University's Sea Grant office there, for the annual HABS forecast, and they predicted it would be around a 7.5 out of a 10, and that dissolved phosphorus is actually down about 30%. Well, no one's been putting any fertilizer on fields, so that would make sense why there would be a 30% reduction in phosphorus. But it's a very complex story. And one of the things that Rotary has done very well, and one of the reasons I think that they wanted to work with me on this project, is we want to find ways to get all the different players to work together. That includes agriculture, that includes scientists, that includes health professionals, that includes a real soul-searching approach to what our priorities are in terms of land management and taking care of the Great Lakes. This documentary started out as a small idea of really focusing on some of the measurement assets in the Great Lakes and how those are letting water municipalities and other stakeholders understand in real time what's going on in the Great Lakes. And as I've learned more, I come at this as a novice as far as the subject matter. I think the approach to the story has grown and developed and morphed in many ways. So the goal of this project really is to make a documentary film about harmful algal blooms in Lake Erie by looking at the inputs, by looking at results, meaning the bloom in the lake, and looking at productive, proactive ways that folks are managing or trying to manage and reduce phosphorus loading in Lake Erie. And that includes also trying to understand, when does this become toxic? When does it flip from being an unsightly algal bloom to a toxic algal bloom? But this, of course, has national importance. So this story may take us somewhere where we're looking at why are we talking about algal blooms more and more across the country, not just in freshwater situations, but in saltwater situations. The interesting thing about what's going on here is that folks around the country are looking to the experts in Canada and the U.S. around Lake Erie to really understand, especially with a model like what Gloss is doing, how do we best address a situation like this? I'm very excited to tell this story. I'm honored that Rotary has saw the merits in the idea and the direction we're heading, and I anticipate having this project completed probably sometime around March of next year, although it keeps kind of growing as my understanding of the situation evolves. We just found interest from NIH. National Institutes of Health are taking a serious look at this now, and they want to know how we're dealing with this in Lake Erie. Tomorrow I'm going to be on an airplane out of Ann Arbor with Dr. Tom Bridgman, and we're going to be looking at this bloom that happened over the weekend. So we're looking at as many different angles of the story as we can to weave a very complex story, but that is understandable to many, many audiences. And hopefully we can influence our decision makers. Hopefully we can influence the public's mindset on what our individual responsibility is in terms of land management and taking care of our Great Lakes. And I'm honored as a storyteller to have the opportunity to interact with so many people to tell this story. So thanks again, Tom, and thanks all of you. I'm happy to answer any questions when I meet you individually.
Thank you very much, David, and please make a good video. The lakes have to be cleaned up. We have new members today. We love new members. And somewhere, David, if you'll come to the podium, just a few things about David. He's a Rotarian, and he likes trees. He can explain why when he wants to. He also likes tree houses, which is probably a good thing at Metro Parks. And he's a huge Ohio State fan. So, David, if you'd come forward.
Good afternoon, Rotarians. I am thrilled to introduce these two new Rotarians to you today. If you remember a couple months ago when I spoke to you and gave you an update about Metro Parks, I talked a lot about our vision for the community right now and how we see our role as an agency really playing a strong role in moving our community forward. One of the reasons I'm so excited to introduce these two ladies today is because they both play integral roles in not only moving our agency forward, but moving the entire community forward. So firstly, Allie Effler is the new Director of Philanthropy at Metro Parks. She started in 2017, and just in that short period of time has made some significant accomplishments. She's led the effort to relaunch our own private foundation, which then, after relaunched, kicked off the campaign for the country's largest treehouse village, which is well underway, and actually the project itself is nearing completion, so we're thrilled about that. Ultimately, her work focuses on deepening connections with the community and translating those connections to not only longer-lasting support for the agency, but a connection on how to move the community forward together. Prior to joining Metro Parks, Allie led leadership and planned giving at the College of Engineering at University of Michigan. So against my better judgment, we hired her anyhow. She completed her undergraduate work at Miami University and has a master's degree in public service from DePaul University in Chicago. She currently lives in Ottawa Hills with her husband and her two children. And as I noticed walking in today, I think many of you know her because half of you apparently are family members. There's a long list of Effler name tags outside. So Allie Effler. The second introduction today is Carrie Alexander, who is a very new member of our team, just weeks with us. But this was a really specific hire for us. As a governmental agency, her position is really unique. Carrie now holds the position of Chief Strategic Planning and Business Development. So this was a very specific hire for Metro Parks as we look to how we intend to move forward. Ultimately, she is responsible for optimizing services and enterprise activities to increase earned revenue for our agency in a way that's totally compatible and responsible to the mission that we pursue. She also leads the planning and prioritization of initiatives to achieve our overall goal of moving the community and the region forward. Prior to joining our team, she spent the better part of her career, over 15 years, working as a private management consultant for Finley. She has a BBA from, again, the University of Michigan. So this is probably the biggest testament I can give to both of them. As the world's biggest Ohio State fan, we still hired them both. She also has a MOL from Lourdes University. So I think you will find them excellent additions to the Rotary, and we're certainly thrilled to have them on Team Metro Parks.
Welcome to Rotary. You are now the newest Rotarian in the world. You've joined 1,200,000 Rotarians. Welcome to Rotary. You are now the newest Rotarian in the world. Good luck in your Rotary journey. Good luck. Welcome both. The presenter today, the presenter of the presentation today, is Pat Sheehan. I asked Pat to tell me a few things about himself and tell me something funny, and didn't work that well, so I had to make up some stuff. No problem, I can make up stuff. I can tell you that Pat has been running our Youth Study Exchange and has been a host family, and we're grateful for that. I can also tell you that Pat has learned some slang with his host families, right, bro? Inside joke for those of you that attend regularly. And I also asked Pat, well, what do you need? And he said, I could use a friend. So after the meeting, Pat's around if you're so inclined. Pat, can I leave it to you?
I was reluctant to give Tim any good material about me, so. President Tim and fellow Rotarians, it's my pleasure to introduce to you the President and CEO of Harbor, Mr. John Sheehan. I had the pleasure of serving on the board at Harbor for several years, and I guess it was about 7 years ago our CEO at the time, Mr. Dale Shreve, took a job with a national organization, a well-deserved move for Dale. But all of a sudden at Harbor, we were faced with losing our CEO that had been with us for over 30 years. And we went out and hired a search firm, and we knew we had really big shoes to fill with Dale leaving. And anyway, we met with the search firm, and they brought a list of really great candidates to us. I want to say 7 or 8 different candidates. And our first meeting, we were going through all the resumes and the names, and John Sheehan popped up as one of the names. And at the end of the meeting, I said to the recruiter and to our committee, I said, that's my guy. John Sheehan's a guy. Kiddingly. But I said us Sheehans need to stick together. We share a last name. But anyway, we went through an extensive process of evaluating candidates. And at the end of that process, the name John Sheehan bubbled up to the top. And I want to say John was clearly our number one choice. And we were really pleased when John made Harbor his choice and came to Toledo to serve as our CEO. And that's been almost 6 years now. That's hard to believe. When you're evaluating candidates, you do the best you can to figure out how good these candidates are going to serve. And what we knew about John is that he was a great visionary. We knew he was an innovator, and we knew he was passionate about mental health. And it wasn't too long after John came on board that we also realized what a big heart John has, a heart and compassion for the people in our community that need mental health services. And we're so pleased that John has joined the team and has been just a great, great addition. The other thing that we knew when we hired John, but just weren't certain, is, we have the rough waters of the healthcare industry to navigate through. And John's just done an incredible job under very difficult circumstances to lead Harbor through that storm, so to speak. So, I'm not sure during my tenure as a Harbor board member how much I really contributed to the good cause of Harbor. But one thing I'm really, really proud of, and that is to be on the team that hired John Sheehan. So hopefully you've all read John's bio. He's going to tell you more about Harbor. I want to tell you, though, that John has a great wife, Bethany. Bethany and John have 3 children, and they have 3 grandchildren. And this won't show up on his bio, but I also know John is a longtime triathlete. And if you show up at the Sylvania Triathlon someday, maybe this next one in August, you might see John towing the line to do the triathlon. So good stuff there. But anyway, with that, please join me in giving John a warm Rotary welcome.
Thank you so much. Wow. Well, I got to tell you, it's a great feeling to have Pat Sheehan introduce you that way. I'll just make a quick comment about that. When I went back to Ireland, there's a few strains of the Sheehan family. So there's kings and queens and business leaders. And when I went back to Ireland and we checked out our ancestor at the local church, we found out he had died 20 years earlier, but he was the town bookie. So I just want everyone to understand that Pat comes from the other side of the Sheehan strain. It's the good side. We're a little different side of him on our end, near Tipperary anyway. I do have 3 members of my team here with me I want to introduce to you because they're really hardworking people and they've been doing a lot of really great work related to the topic we're talking about today. And I just want to introduce him. Steve Benjamin is our Chief Clinical Officer. And Steve has been with Harbor, stand up please, and he's been with Harbor for more than 30 years. Steve is really the soul of the organization and does quite a bit in the community here. Donna Jablonski is our Chief Operating Officer. And Sandy Hall is the president of our Lighthouse Division, which does a lot of our telehealth and our administrative services and our EAP. So I want to introduce those guys. Great. Okay. Slides. Okay, so our agenda today, we're just going to talk a little bit about Harbor. I'm going to run through this a little quickly. The future state, the triple aim, service outcome and cost, the reason that we're here, prevalence and the cost of behavioral health, physician-led teams in trauma-informed care, outcomes, what are outcomes in healthcare, patient-accountable culture, millennials, which make up the majority of our workforce and soon to make up the majority of our patients, and then some information about how to contact us if you need more information about Harbor. So, Pat mentioned that I've been hired to be the CEO for Harbor. Harbor has been serving the children and adults in this community who have mental health and substance abuse disorders for 105 years. As the CEO of Harbor, I was raised in nonprofit healthcare, and so I was raised to be a steward of the assets of this organization. What that means to me is, I've only been here 6 years, right? So for 99 years, somebody else didn't screw it up, right? So it's my job to just not screw it up. I got to make sure Harbor's here for at least another 100 years, right? And that's a big responsibility, particularly given the current environment. Let's give you a little better look. We have grown exponentially since I've been here. We've about doubled the size of Harbor in this 6-year period by acquiring other organizations that provide like services. And that's allowed us to grow, but it's also allowed us to learn how to do things differently, to bring other cultures into Harbor, and to learn about different communities and what the needs in those communities are. So it's been a really long journey, but it's been a really meaningful journey for Harbor because we are a learning organization. We have a lot of history, we have a lot of knowledge, and as an organization, we have a lot of wisdom about how to take care of people in the greater Toledo area. We serve about 23,000 clients annually. Basically, that's broken down into our mental health services, which is the majority of our focus. About 78% of our services are vocational services, which are helping folks that have a disability train for work, get back to work, learn how to find a job, learn how to just habilitate, keep a checkbook. We do a lot of that type of work, and that makes up about 8% of what we do. We also have a very large book of business, over 90,000 covered lives for our EAP program. That makes up about 5% of our business. And then we also have a substance abuse program that makes up about 8% of our business. What I'm really proud about the substance abuse program at Harbor is when I got here, we didn't have a substance abuse program. We started working in earnest to develop that program about 4 years ago, and now it is a truly comprehensive part of what we do. A very important piece of the continuum of care in Toledo is the Women and Children's Substance Abuse Program, where we treat women who are addicted to opiates who are pregnant and ready to deliver a baby. We've delivered over 45 healthy babies through that program. And again, it's only about a 3-year-old endeavor. And so I'm really proud of Harbor and the team and the way we responded to a community need that way. So today, with the mergers and acquisitions, we've acquired Behavioral Connections of Wood County. We just acquired Central Community Health Board of Cincinnati in Cincinnati, Ohio. And again, Harbor's gone to a size of about $65 million in general revenue from about $31 million when I got here. So we have doubled the size of the organization. We have quite a bit going on. We have a lot of complex programs that we're running, but we're also in the middle of healthcare reform, and we're also in the middle of a time in healthcare where we're sort of hanging between the two trapeze. And in particular, behavioral health is in a state where we don't really know where we live at this particular time in healthcare. We're really in a transition, and I'll talk a little bit about that in a moment. So talking about our treatment services, Harbor does a very comprehensive job of assessing folks, making sure that they have the right quality assessment at the front end, including family members, including everyone in the family that might be affected by an individual's diagnosis. We then wrap a treatment plan around that individual and deliver care. So one aspect of hanging between the two trapezes and sort of trying to figure out where does behavioral health fit into the future state of healthcare. And so now stigma's going away. Behavioral health has become much more popular to talk about, right? The mass shootings, which are kind of a double-edged sword, have brought a lot of attention to what we do, right? There's a lot of money flowing to behavioral health from the Wall Street, from for-profit sectors where it never used to flow. It's a very interesting time. The Affordable Care Act, whatever your politics are, strengthened the essential health benefits, which by proxy strengthened what we call mental health parity, which means now one of the essential health benefits that you're entitled to as an insured person in this country is to receive behavioral health services that are on par or in parity with any other service you receive. Now that's important because that was never the case before, okay? Before, the way it worked was there was all other health conditions, and then there was behavioral health. You got like 5 outpatient visits, you got a certain number of inpatient days if you were Medicare and disabled. Most commercial plans didn't pay for anything. And if you said, well, my behavioral health condition is just like my heart condition or my other condition, well, no, it wasn't. It was very different. Okay, so for most of my career, people didn't get access to the care that they needed because no one would pay for it, including government entities. That all changed in 2008 when parity was strengthened, and it really changed in 2010 when the Affordable Care Act brought through the essential health benefits. So when you hear people talk about changing the Affordable Care Act to get away from pre-existing conditions, remember that that is really the essential health benefits. There are 10 things you're entitled to, and behavioral health care is one of them. And going backwards from there, in my view, would be really devastating to a large population of the folks that need that care in this community. So the future state for us is, if you see on the left-hand side there, these are all the places where our patients come from on the left-hand side, are our referral sources for the most part. We get patients from hospital emergency rooms, hospital medical floors. We do assessments on nursing homes, long-term acute care facilities, community agencies who are treatment facilities like Rescue, Zeph, Unison, all refer to us. Law enforcement brings people directly to us, and we have folks that are engaged with jails, parole, and other types of services, and we also do quite a bit of work in the schools. In fact, Harbor is known for its work in the schools. This is all being wrapped around what we like to call a continuum of care. And Harbor was one of the 35 original health home models under the Affordable Care Act. We were one of the pilots. We had the largest health home for adults and children in the country, right here in Toledo. That's a claim to fame for Toledo, but it really it really identifies the need. It identifies just how sick some of the kids in our communities are and how much they needed that health home model. Some of the adults that are disabled in this community that just migrate through the different systems, health home was a life changer for them. It lasted for 5 years. It was supposed to be a 2-year pilot. The outcomes were so amazing that we were able to keep it together for a couple of more years. And it aligned all of these services into that continuum. All right, next slide. Sorry. So I want to talk a little bit about what we call the triple aim in healthcare. All right, so back in the 2000s, we took what we were doing.
The triple aim was
administrators,
the
and we turned it
brainchild.
into something called the triple aim. So I'll let the video play, and you guys can hear from Don Berwick. Now, Don Berwick's a famous guy in terms of understanding healthcare and how costs work and all the things that go into that. He's a Harvard guy, and he's the president of the Institute for Healthcare Improvement. So.
The triple aim was the brainchild of 2 of our faculty, John Whittington and Tom Nolan, who came up with it in about 2006. I remember them coming in with the idea. And it was a real breakthrough. So the goal they had in mind was to articulate in a very efficient way the aims of healthcare. Up until that time, the answer would have been probably the best answer would have been reference to the Institute of Medicine report, Crossing the Quality Chasm, which had laid out 6 dimensions of quality, 6 dimensions of need. They call them aims for improvement. And those, most people in the field now know them. They're safety, effectiveness, patient-centeredness, timeliness, efficiency, and equity. Everyone up until that point would have said, well, that's what the social need is, the 6 aims. And Whittington and Nolan said, no, wait a minute. That's about if you need the care. So if you need the care, absolutely, it's those properties should be there when you care for your heart attack, your broken arm, your depression, or you get your checkup. In the individual experience of care. But they said there's actually a second component of AIM, and they call that the health of the population. Because why do you have your heart attack? Why did you break your arm? Why are you depressed? And the causes, they don't lie in healthcare. The cause of illness isn't the absence of healthcare. Healthcare is a repair shop. So they said that society also needs us to help you stay healthy. And the third aim they added, which I think was particularly brilliant, is while reducing per capita cost. And that is because the needs of the society, the people we serve, go beyond healthcare. They've got other things to do with their resources. They may want to go to the movies tonight, or a corporation maybe want to be more competitive and pay its workers more, and government may need to put money into roads or schools. So they posited this collection, this system of aims: better care for individuals, better health for populations, and lower per capita cost as is a complete statement as they possibly could of the social need we're here to fill. It's like a compass direction that tells us what success is. And that became known as the triple aim.
Okay, so everything you ever want to know about healthcare was right there. All right. So in 2006, we started talking about the triple aim, all right, which is the three-legged stool, or however you want to look at it. It really boils down to three things: service, outcome, and cost. So how do you feel when you go to your healthcare provider, right? How do you feel when you go to the hospital, right? What's that experience like? Is it a delighting experience? Is it something you want to do again? Don't think about the dentist, but think about the doctor, okay? All right, there's a lot of urgent cares today, right? There's a lot of ways for you to go online today, right, that are more convenient. Okay? So what's happening, I think, in healthcare is we started off with this view, and this started a little earlier than 2006, but when I was coming up in a big health system, okay, what I was being taught was everything was this balance between the patient's experience of the care, right, the outcome of the care, which, by the way, we didn't really do a good job of including the patient in that whole outcome discussion for a long time. But the outcome was important because that was really what happened, right? Whatever you did, what did it do? Okay, and then what did it cost? Right? So this was the first attempt to look at healthcare from a business standpoint, right? From a widget standpoint. The problem is that you're using statistical process control. This is Deming and Shewart, right? This is the stuff that they use to make sure that a widget is made to a certain variance, right, every single time. You can measure that widget. It's going to basically be the same every time up to the 6 sigma level of whatever you want to do for statistics, right? That all goes out the window when you have a patient in front of you that has multiple problems going on, might have a mental illness, might be drunk, right, and might have a life-threatening illness. And you're the ER physician and you got to figure that out, right? In an average of a half an hour so that you can keep yourself within that service outcome and cost loop, right? Okay. So this is an interesting conversation that started a long time ago in healthcare that we're now starting to say we're going to take it from service outcome and cost to value-based, right? And nobody really even knows what that looks like because we haven't really figured out service outcome and cost yet. Service outcome and cost is based on the theory of fee-for-service healthcare, right? But people don't really fit into those boxes. Healthcare is not really a business. Can you really make healthcare a commodity? And I'll give you a great example of that. Do you want the president of any hospital checking the stock price the morning before they staff the hospital? Or decide, what kind of equipment they're going to buy for that hospital? I don't. Okay? So these are real issues. I don't have any answers for you, but these are real issues that I want to talk about today. And I want to bring it back to behavioral health because I think it's important for you to understand what's happening in behavioral health and why there's so much energy around it. And I talked a little bit about the clinical side of it, what's important about the essential health benefits, what's important about people getting the treatment that they need, right? That's better care, right? It means children get what they need earlier. It means they don't become adults that are dependent on the system. But if you look at the prevalence of behavioral health care and the issues that they bring about in the population, nearly a quarter of people in this country have a diagnosable behavioral health disorder. Patients with behavioral health problems are 3 times more likely not to follow their care recommendations. In fact, behavioral health disorders, by definition, cause people not to follow their treatment plan. Okay? So we have an epidemic of disease in this country that has not been treated, and not been treated with the patient in mind and with the disease in mind. People don't want to seek treatment that have this disease. So we have to keep that in mind as we attempt to treat this problem in our healthcare system. So this is 2013 data, and I think this is fascinating. This goes back to us being in the risk pool. Before 2008, behavioral health disorders were not on this chart. There is not another chart out yet. I expect it will be out sometime this year showing the cost continuum. We went from 2008 until 2013 not being on the cost radar for chronic disease, right? We jumped pulmonary, hearts, cancer, trauma, all heart conditions, right? In 5 years. 0 to the #1 cost in the system. And this is why people from Bain Capital and Wall Street are suddenly calling me saying, hey, how do we deal with this, right? Because this is a huge problem that nobody talked about for the better part of my career. And now we don't know how to solve it. Now we know we have the problem, but now we're all hanging between the two trapeze over what's the next crank on healthcare. In behavioral health, we're just sitting around trying to figure out what's going to go on. Because in this state, we've tried to outsource to Medicaid, we've tried to do all kinds of things to get the costs under control, and none of it's working. But people still need the care. And so Harbor and Unison and Zeph, we're still sitting here. We're still treating people every day. But we're not getting paid very well for it. We're not getting paid the minimum we should be paid for it. But we continue to serve the community just like we have for the last 105 years. Okay? So the way we work on service outcome and cost, the way we work on the three-legged stool, the way we say we're going to provide the most access, the best care, right, with the best possible outcome. And I believe that money follows quality. So those are the really two important things. And then there's cost. It's always an issue, right? Talk about today, we talk about Medicare for all and all the things that are being talked about, right? Any hospital administrators in the room? Anyone who works in hospitals that tells you we have to get under Medicare costs in hospitals, you know, that's a real tough thing to do. But it may be what we have to do. I can tell you the big towers and all the investments that we've seen in healthcare, the CFO and the CEO that could make up their campus plan, and that was all you had to do in healthcare to be successful was make sure you had enough capital to build your next building. That is not what's happening anymore. When we start talking about behavioral health and physician-led multidisciplinary teams and trauma-informed care, that means that we can't just wave goodbye to a patient in the parking lot and hope that they get better, right? That means we have to be able to track a patient across modalities, across different types of care, different providers, different organizations. Mercy and ProMedica have to share information for patients to get well. And Harbor has to be pushing and pulling data as well, right? Because if that data isn't on the table, when that treatment plan's being written up, that patient's not getting what they need, right? That's healthcare. That's healthcare, is sitting around a table with a multidisciplinary team of people that have all assessed a patient and deciding what is the next right thing for that patient, and then including that patient in the conversation and making sure that they follow through and standing behind them while they follow through. That's how you take people from where they are to where they need to be. There isn't an insurance company, there isn't an EOB, there isn't a bill somebody sends, there isn't a phone call somebody makes that gets somebody who has a severe and persistent behavioral health disorder or even an adjustment disorder from where they are, which is the worst moment in their life, which is usually where we meet them, to where they need to be. It's an individualized process. It follows that general loop, service, outcome, and cost, right? But it's a lot more complicated than that. And so I think that's important to point out to everyone that thinks they know something about what's going on in healthcare right now. It's a lot more complicated than that. But I want to show you something that's not really complicated. I want to show you something that I am really proud of, okay? When Harbor took over, as I mentioned, these almost 7,000 lives through our federally funded health home, we had claims history for those folks who had been in Medicaid for years before coming into this new program, right? And I want you to look at these slides. I don't know how well you can see the numbers. I can't see them very well here. But essentially, for both cohorts, adults and children, we dropped emergency department visits and we dropped hospital admissions by more than 50% for that same group of people that had the same claims history before health home and the same claims history after, right? For 5 years. Steve Benjamin and I went to Columbus and we fought for this program every year, tooth and nail. And then we were able to show these kinds of results. And you know what happened? They shut it down. They shut it down. And you tell me why that happened. Why, how many kids? 3,300 kids in this community don't get this service anymore. When Medicaid has a, $300 million surplus this year. They shut it down. They actually cut our rate before they shut it down. Okay? I don't know of any other program in the country that can show these kinds of outcomes. Okay? And that's what's wrong with healthcare today. We talk about service outcome and cost, but it's really about stock price, it's really about pharmaceutical cost, it's really about insurance companies, and it's rarely about the patient. Okay? So at Harbor, we do it a little different. Our culture is based on something called the trusted model. Are you a team player? Are you responsive and respectful? Do you take the time to understand, or are you doing drive-bys in the hall? Do you stop, make eye contact, talk to a patient, talk to a family member, talk to a team member, and really listen, right? Is it safe? Can you raise your hand and say, I have an issue about patient care I think we should address, or I have an idea for improvement, and not have an arrow flying back at your head, right? That's the we part of it, TRUS. Team player, responsive, respectful, understands, and it's a safe environment. The me part of it, okay, the part we expect from individuals is, are you talented, do you execute, and are you dedicated to Harbor and the people we serve, right? That's the me part of it. And that's our culture. It incorporates our mission, our vision, and our values. And every day we talk about our trusted culture. It's a touch point for us to do the things that we know we can't trust the system to do or other people to do. We have to do this for our patients, because that's why we're here. Oh, so I just want to touch a little bit on millennials. I don't want to go too far through it. But millennials get a lot of flack. And I think this is one of the biggest issues that we're facing as an organization and as a culture, which is we're treating different kinds of people. We're hiring different kinds of people. And if we can take the time to understand millennials a little more, because we have to, this slide points that out, they're going to comprise 50% of the workforce. And I can't continue to entertain the idea that we just can't work with these people, right? That's what I hear all the time from people that aren't millennials. I can't work with them. Well, we're going to have to figure that out, right? Okay? And what I think the characteristics, and this is, for millennials, this might be a little insulting, but treated as special and important, sheltered. I don't know that that's completely true. Confident, team-oriented, achieving, pressured and structured, that's for sure. These kids put more pressure on themselves than we could ever put on them. But I think one of the things that I've heard more than not from millennials is we want to be happy, which makes most of us laugh in healthcare when you've been doing this a long time. But if you really think about it, they were raised this way. There is a real value there that millennials hold to want to be happy and have work-life balance. And so we're working hard on that. And I think that relates to just having better leaders that understand them better. And so that's something that Harbor is really trying to take its trusted model and work it into how we engage our workforce and how we engage our future patients. And again, we're leveraging technology, we're leveraging market share, we're leveraging strategy, we're leveraging acquisition. We're doing everything we can to survive. Because what we do for Toledo and what we do for this community, if we were to go away, the health of this community would be in question, I think, for generations. And that goes for every other agency that provides similar services. This is a great community. It's a community with great needs. Since I have been here for the last 6 years, I stayed in this hotel when I interviewed. All right? The board was shocked that I walked down to the Toledo Club by myself because it was so dangerous. This is a different place due to the good work of the people in this room, right? Right? We deserve the best health care in this community. Every child in this community deserves to get the services that they need. I'll just leave you with that. And thank you all for taking the time, and let me talk a little bit about what we do. Thanks.
Thank you, John. I had no idea we spend more on healthcare than we do on cancer in this world. John will stay around after the meeting for questions. I would like to thank you with this book for your presentation today. And also, we will make a polio contribution to the polio fund to eradicate that disease in your name. Thank you very much. Next week, we have Troy Wildemuth from Center for Innovative Food Technology as our speaker. I would like to welcome Allie and Carrie as the almost old or newest and newest Rotarians in the world. Dave, I'd like to wish you good luck with the production. And Chuck, we'll do this next, we'll do Chuck Chuckles next year, or next, next week, if you don't mind. Today, after the meeting, we have the Peace Committee meeting in the Presque Isle Room, and we have the Water Services Committee meeting in the North Cape Room. And Fred Lefevre, you weren't introduced as a guest, but welcome as a guest. And with that, we are adjourned.